Hello, I'm Scott Fleischman for Gifford Healthcare. Thank you for joining us for today's interview. I'm joined by Gifford's licensed mental health counselor, Erica Schleif, and we're going to be talking about children's mental health during this pandemic, fall of 2021, children going back to school and how they'll be handling it mentally. If you like this interview, we have plenty more where that came from. Go to our YouTube page, give this video a like, subscribe to the YouTube page. We will be constantly posting videos, information that you'll need to know right here on our Gifford YouTube page. But for now, Erica, thanks for joining us today. I know you have a very busy schedule. Tell us how you got into behavioral health.
Well, it's kind of been a lifelong passion for me. I have known I've wanted to do this since I was 14 years old. I felt like I went through some experiences in my life that kind of made me a little bit more in tune with people's feelings and thoughts. And I've always been really compassionate and empathic, and it's just something that kind of clicked with me. Yeah.
And how did you end up here at Gifford?
Well, Vermont is amazing, and I wanted to move here. My husband was born in the hospital 40 years ago, and Dr. Bory was his pediatrician. We love to talk about that with him because he got really close with Dr. Bory growing up. And it's just been a kind of a dream of his to move back to Tunbridge, and I found Gifford. And to be quite honest with you, didn't really want to work at a hospital. And so I interviewed thinking, okay, I'm going to, and probably not move forward with it. And I walked in and I met the people here and I fell in love. I mean, it was just, it clicked. It's an amazing hospital. And I feel like one of the most important pieces here is that they really, really value mental health. And that was really important. And I feel like we can make a difference here with mental health. And I feel like the care for patients is just, it's wonderful. It's a great place to be.
And you came to Gifford right as we were hearing rumblings about this pandemic, right?
Yeah, so I started in November, and January, February, I think we started talking about this scary thing called COVID-19. And I had flashbacks of Ebola and just like fears around other pandemics that you read about that just doesn't get here, right? We don't get it here. So I was sort of just running the course thinking, okay. And that was when I learned I was an essential employee. I had no idea. I didn't know what that meant. So I realized that I was going to be here, and I dove right in. I was ready to do it. So.
As everybody's trying to figure out their role during it, did you have a tough time figuring out what your role is?
Yeah, it took me a while. I found myself sitting in my office a lot, not sure what to do. A lot of clients sort of either fell off, weren't coming in anymore. We were uncertain about using Zoom and phone calls. And even if I was on the phone with some of my clients, that lasted maybe 15 or 20 minutes in the beginning because it's hard to do therapy by phone. And then we started to get a hold of Zoom a little bit better. We started to get more accounts, clients were able to access it. And as I was sitting here researching and reading and trying to just figure out, what am I doing with all this time being here? I started to think about how employees were being impacted. I started to think about Josh and Rebecca, and if I was in that position and had to make all those big, huge decisions, how would I be managing my own mental health? And are you checking in on, everybody here? And so, I started talking with Sarah Roberts, and we started working more towards just some employee mental health. We couldn't access much of the community during that time, which was really hard for us because those are our people here, that's who we worry about. And then in talks with Rebecca and Josh and the other behavioral health department team members, we started to find creative ways to get connected with the community and getting connected with pediatrics and getting parents and children ideas, what to do during the lockdown, what to do when they had nothing else to do. Trying to find creative ways to just make sure that people were okay. So we just got creative and we used our time as effectively as we could.
When did you start to see the shift from, okay, COVID-19 is this terrible, terrible virus. It's killed so many. And that's the physical part of it, right? But
Yeah.
when did that shift start to come to the mental part of it? Because as we've come to find out here, now fall 2021, it's really just as taxing. It can be just as taxing mentally as it can physically.
Yeah. I want to say as soon as, the federal government, governors, whoever it was that finally made decisions, started to say, hey, we're going to ask you to stay in your homes. We're going to ask you, not to leave. We're going to ask you to kind of just socially isolate. My nerves just went up right away. I was nervous in that moment, thinking, what is this going to do to people? It's a complete opposite of what we say in mental health. If you have depression, if you have anxiety, we say, get up, go out, go see people. And here we are saying, sorry, you can't go out, you can't see people. And then we're telling parents, hey, turn on the TV, turn on screen time, give more time. And so it was literally the opposite of everything that we were saying almost immediately. I would say it started to get more on our radar in terms of how bad this really was when we got into the fall. When we got out of that summer, we had that break in the summer of like, oh, you can kind of see people because we can be outside, and the world started to feel a little bit better, right? And then schools were like, we're not doing this again. We're not doing this weird. We don't know what we're doing. And so they went either hybrid or they went full, just full, whatever we're on right now, full computer. And that was when it really kind of kicked in, when people realized, okay, this isn't going away. So we started to see more kids with anxiety. We started to see more parents with anxiety. We started to see a lot more uncertainty. I think Gifford did an amazing job of keeping our ED really empty of some of the, suicidal fears and concerns, because we never stopped connecting with our community. So I think for us here, because we were so connected, we were able to see the mental health shifts and able to be a part of the mental health shifts, as opposed to picking up the pieces, after everything happened.
I think virtually, right? Virtually is.
Thank you.
Yeah, I know. I thought you might get it.
I thought I was going to get it too.
Here we are a year later from that now, right? We are going into fall of 2021. And if you were to tell me a year ago that we'd still be talking about this, I really thought that by a year ago, okay, fall 2021, students are going to come back and there won't be these issues that we've seen. And here we are, and we're going right into this another school year where there's high anxiety. Some schools have mask mandates, others don't. Parents are at odds with school officials, and in the middle of this all are the students. And they've already taken a hit from this.
Totally.
And people will say, oh, well, kids are young, they'll get over it, but that's really not the case.
Yeah, I would say that, kids were resilient in the beginning, right? Like I had hope for kids in the beginning, and I still do, but we can say, yeah, kids are resilient. They can do this. They can do this. It's still true. So what's happening, I think, with kids who haven't been, extremely affected by COVID-19. And what I mean by that is they haven't lost a parent to the illness, or they haven't lost a loved one to the illness. Their parents still have their jobs, they still have their homes. Those are kids that are not experiencing a toxic form of, change and trauma. So I do think once things start to go back to normal, whatever that's going to look like, I do think that the resiliency in children is going to pop out. I would say what the concern is, though, is that Some of these kids did not go through COVID-19 that way. And that's where the resiliency, that can support them, but kids were isolated severely from their peers, from school. We have schools in person for a reason. And it's so that they can see their friends at lunchtime, and so they can see the teachers face to face, so the teachers can see them. Teachers can know how they're feeling, how they're doing. And when you talk about like 2021, I remember 2020 and New Year's Eve and thinking like, oh, the world is going to change tomorrow. And we're what, 4 months from 2022? And I feel like it's sort of a little bit like Groundhog's Day. Like we're kind of right back there. I think it might feel like for kids going back to school now, I think the anxiety of the what ifs is shifting too. They have no idea what's going to happen. Most of the kids I talk to now think we're not going to be in school that much longer. School's going to shut down. And I think they're nervous about that.
Are they more nervous about that aspect of it than actually getting the virus? Especially if they're unvaccinated, 12 and under, can't get the vaccine yet.
Yeah. Most of the kids that I talk to here, I'm just going to wear my mask. I'm just going to put my mask on. I'm not, quote unquote, from one of my clients, I'm not an idiot. I'm going to wear my mask. But what I'm afraid of is how this is all going to change when somebody doesn't wear their mask or someone does bring, COVID into the school. We're all going to have to go home again. And I don't want to do that. That's a really big fear for these kids. The level of anxiety that I watched over the past couple of days of talking to the students who did go back, you can see there's just this like relief in them that they're back in their classroom, that things feel a little bit more normal. There's hope that they can make new friendships or do better in school this year if they didn't do so well. So I do think that the fears for kids is not the disease itself. I think it's the symptoms of the disease for them.
There's a lot of, as I mentioned before, there's a lot of butting heads when it comes to teachers and school officials as to rules and mandates. Are the kids affected by that? I mean, you turn on your TV and you see one side of an argument being very passionate and another side of an argument being very passionate. It's just adults. It can come off as maybe just adults screaming at each other for no reason. I mean, is that having an effect too?
Yeah, I would say it's actually been having an effect since, unfortunately, the start. And it was very confusing for all of us. But then you think about kids who really have no control of anything to do with how adults make decisions. And, now they're so used to wearing masks. And in a lot of kids' heads, they're like, this makes sense. Why wouldn't we wear masks? Why are the adults fighting about this? It's kind of become second nature to some of these kids, especially the younger ones. I mean, I would go down as far as my 3-year-old who doesn't know life without a mask. It's just normal for him to put it on. And I think that with kids, they adapt really easily. So it makes sense to have a mask on for them. And watching parents argue and watching, friends' parents argue and separations of friendships that maybe wouldn't have separated previously just because one has the idea that you need it on and one has an idea that you don't. I would say for the parents that are worried about their children wearing masks, I get it. I totally get it, because it does feel like you can't see the emotion on the kid's face, and it, deters socialization. In some instances, some kids are really quiet, and wearing masks feels like you're not going to hear my child. My child's not going to be able to talk anymore. So I understand it from that perspective. And I think that, we have to hear both sides, but for safety purposes, the science has always said, wear the mask. And I think kids hear that. I think kids get that,
You're talking about parents' reactions to things. You parents have been asked to do a lot since the start of this pandemic, from staying home now to homeschool their children. Some have lost their jobs. Some have decided to leave their jobs. Many have lost loved ones during this entire thing. And, through it all, again, there are the children, and mental health counselors are very, very busy. And so a lot now has to be called upon parents again to help their children with their mental health and to make sure things are okay, right? So I mean, another burden now on parents, but it's a very important one right now.
Yeah, we're asking parents to step up and be the counselor for their children. And that's why we exist, because that doesn't make the most sense for a parent to be the counselor of their child. The child needs a safe space to open up and talk about their fears and their concerns and, their peer relationships, their romantic relationships, their sexual identities, etc. And we are, we're in the medical field in general, we're all overbooked and understaffed, and we are asking parents to do it. I think, you know, parents need to do this in general, and they pretty much know that just maintaining an open dialogue with their kids is the most effective way to get their kids to open up. And I think with COVID-19, there's no difference with social isolation, with not going to school, with wearing masks or not wearing masks, vaccinations, etc. Open dialogue with your kids around what do you think? What are your thoughts about this? Maybe your child is 9 years old, but I guarantee your child has some pretty big thoughts about it and wants to be heard. And if they feel like they're heard, that can really help with anxiety if there's that conversation. I think also with parents, it's helpful for there to be plans. I know it's hard to say that, we make plans and things change. But having the contingency plan set up, having the plan for like the what ifs that might be going through the child's head, like, hey, mom and dad, or mom, dad, whoever it is that, you live with and who's your guardian, we have a plan. We do know how to do this, just to relax the anxiety of kids, and then managing expectations of your kids too. Hey, yeah, you are going to go back to school. You're likely going to be asked to wear a mask, and that might change. I know that's going to be hard, but that's kind of what to expect. I wouldn't, I would be really careful with the like, no, this isn't going to happen again. We've made it through, because parents know that's not true. There's nothing that ever finite like that. There's nothing that's ever absolutely literal when it comes to children. But I think parents are taxed. I think they're really tired, and I think emotionally it's hard to be everything to your child, because that's not the way it's supposed to be. So,
And for parents that might have hit a limit, just because right now there's a strain on the mental health care system doesn't mean that their child can't be helped. It's just a matter of finding that direction of where to go. So parents shouldn't just throw their hands up in the air. They can still reach out, right?
Right. Especially to us, one of the things that we really want the community to know is that we have people here to answer the phone, to talk to you. Make a referral through primary care if you yourself as a parent want to be seen here in behavioral health and or your child. That doesn't mean that we get to see them right away, but you will get a phone call from our social workers, and you will be able to connect and say, this is what we're experiencing, this is what we need, and we're going to help you find that. We might have to say, hey, it's going to take a little bit of time, but we're here, and at least the conversation has started. And sometimes that's all someone needs, is to know, okay, like there are people there, they know we exist, they haven't forgotten about us, they're going to connect us to services. And we're getting creative here all the time. We're trying to, establish groups here, to connect out into the community. We're a little bit behind on connecting with children and adolescent groups just because of vaccination rates in that situation. And now we're back to school, so it can make things a little bit difficult. Also, if we ask you to now get your child to a group on top of getting them to school and making sure their homework's done and cooking dinner and etc., we're adding to the laundry list of things that, you need to do as a parent. So we're trying to get creative, and we're open to suggestions and needs of the community as well. We are here to really serve the community as much as possible.
And what about telehealth as an option?
Yeah, so we did a great job here of going into Zoom and learning Zoom and figuring out how to do therapy and, primary care visits. We were doing those by Zoom. That was amazing that Gifford really stepped up and said, okay, we're tackling this the best we know how. So telehealth is absolutely an option, and it's really effective. It's really effective for kids that can't get here, whose parents can't get their kids here, who live a little bit further away. I mean, we're in rural Vermont, so that's meeting a need that was needed before COVID. It also is, I think for kids, they're actually enjoying being able to use technology because it's what they know best. They know it better than we all do. So I think for them, it's been really helpful. There are some kids that, prefer to see us in person, and that's perfectly okay, but we are offering telehealth.
And so as we kind of go down this road and hear, light at the end of the tunnel, or, what's to come, what's, as we kind of wrap up here, what's kind of your last message? Because I think a lot of parents are watching this and they've gotten a lot of good tips and advice so far, but what's maybe, one lasting message you can give them as we head into this school year and then, you know, going on our second year of this pandemic?
Yeah, I would say, take care of each other first. It's just like when you're on an airplane, you put the oxygen mask on yourself before you put it on the person sitting next to you. And I think for parents, it's really important to make sure that they're taken care of and that they're checking in on themselves so that they can be the best that they can be with their kids. And then, like I said before, open dialogue, you know, sit down at dinner and just ask the questions that you might be asking your peers more, your friends, when you guys are sitting around, talking about how you're handling your children. And I would say ask your kids that question because they're the ones that have the best answers. And we used to, years ago, before any of us were alive, parenting was a community-based situation. So lean on those people safely, of course, but lean on the people around you. Look into your neighbors and say, hey, you guys have kids, we have kids. Can we, the pod situation, kind of getting that back into that. But just don't forget that this is a community situation, that we're all in this. And I think that that's really helpful if we have other people to rely on. We don't have to do this alone. And if parents are really struggling, we want them to have that support and have people around them. And remember that we're here too, I don't have all the answers, and I've got my own stuff going on over here too, as we all do, but that's why we're here. We're here to just work together and figure this out as we go, because we've got experts that know a lot of the answers, but then there's the rest of us, like me, who kind of gets creative and is learning through talking and understanding people's feelings and emotions. So,
Well, Erica, some very informative stuff. I appreciate it. I know that obviously your department is very busy, but if somebody did need to reach out, what's the best way to do that?
So if you are being seen at Gifford through your primary care, if your primary care is here, any of our clinics, go through your primary care and get a referral over to us. I think that's the best way. And if not, and you want to make connections to us, you can give us a call. Emily Pizzali is who we have as our social worker. And you guys can give her a call. And I would say give our main number a call, 802-728-2795, and just ask for her and put in the referral.
All right, Erica Schleif, some great information. Thank you so much. And hopefully parents will take some of this information in, and we can get through this together, because that's pretty much the only way we're going to get through this.
That's the only way we're going to get through it. Exactly.
All right, thanks very much. And thank you for joining us once again. Like this interview, subscribe to our YouTube page. We'll have many more interviews, information coming to you in the next few weeks and months. So for now, this is Scott Fleischman for Gifford Healthcare. Thanks very much for watching.